Yes.
Good day, everyone, wherever you are on this planet. Good morning if you are in the morning, good afternoon if you are in the afternoon, and good night if you are just trying to wrap up your day. So I welcome every one of us all to this meeting, an intellectual meeting, uh, a research-based meeting that we hope to gain more insights on things that has to do with epidemiology, mathematical modeling, public health, and One Health. So we welcome every one of us to this occasion, and we hope that we are going to gain a lot at the end of this meeting. Thank you so much for honoring our invitation, and we promise that this session is going to be engaging and knowledge based. We are blessed with good presenters, and also our organizers are also very active and very good in things that has to do with research. So we thank the BMA, the Black Mathematics Association, for giving us this platform to interact with people and also to share knowledge and disseminate, or let me say, collaborate with one another, with each other on research work, and also to for also giving us the platform to also learn. Thank you so much, BMA, and also I thank the organizers of this meeting, Dr. Dansu, Dr. Adejime, Dr. Kayode, and all other BMA members. I welcome you all to this meeting today, and we are going to, the meeting has already started, and let me just read out the agenda of the meeting, then we start from the first one. The first agenda is welcoming of all participants, followed by brief talk about BMA by Dr. Emmanuel Dansu. So the introduction and citation of the speaker, and also that will be followed by the main presentation, which will last for 60 minutes. Then after that, we are going to have question and answer session. And from that, we have the closing statement, or let me say closing presentation. Thank you so much. We welcome everyone to this meeting. So on my list here, so we are going to go to the second item on the program, which is a brief talk about BMA. So I'm using this medium to invite Dr. Emmanuel Dansu to present to us a brief information about the foundation of BMA, what we can learn and what we can gain, and how we can be part of the collaborating team. Thank you.
Thank you so much, sir, Dr. Rabiu. We are very grateful to have you on board. Okay, so that I would not have my thoughts scattered all over the place, I'm just going to read a script. So, the Black in Mathematics Association, BMA, also known as Black in Maths, is a non-profit organization dedicated to supporting and elevating Black mathematicians worldwide. The dream was conceived by Dr. Adeniji. I'm not sure if he's in the house right now. And we have our co-convener is also here, Dr. Kayode Isaac Oshinubi. Then so I'm here as the lead on the organizing and program side, and Dr. Rabiu is also part of that team, and that's why we are able to do this today. So our mission and purpose basically is to bring together Black mathematicians to address issues like isolation, and underrepresentation in the field. Then we also help to promote visibility, collaboration, research, funding, mentorship, and professional opportunities. So the organization highlights achievements of Black mathematicians, fosters global networking, and advocates for equity in academia and industry. Our key goals include integrating accomplishments and contributions of Black mathematicians. And that's why, we have events, we have webinars, we have Pi View Space. So in Pi View Space, we interview accomplished mathematicians they share their journeys with us. They let us know how they were able to become who they are today. If I remember well, we've interviewed, our very first interview was Professor Bob at Ghana in South Africa, who is a very inspiring mathematician on the continent. We've interviewed Dr. Bakari Emmanuel of Ikamda, and a couple of other people like that. So establishing collaborative research projects, this is one of our strong sites. We started out with, we have a team of collaborators from anybody who is interested. I think the first thing is to just become a member of BMA. And once you become a member of BMA and you're interested in the research group, you are integrated into the research group. And then we started as one unit. And from there, we are broken into, I think right now we have up to 4 or 5. And our research lead is Dr. Shinobi. So I think if I count very well, I think by now we have up to 10 papers published since we started collaborating. So if you're here and you're interested in that, you want to become a member of BMA, and then you can also join the research group. Then securing funding for underrepresented scholars. Well, this is one of our goals. We've not been able to do this on a large scale, but at very small levels, we've been doing this, and we'll keep pushing until we actually get, more funds for researchers. And sourcing employment opportunities. Sometimes you have webinars to talk about scholarships, how to get jobs, and things like that. Then promoting science communication, outreach, and professional training. Of course, that's part of why we are doing this today. Then building solutions to real-world problems through mathematics, with a noted emphasis on building the future of Africa. So you know, we do different aspects of math, but I think we are particularly strong on mathematical biology, talking about especially epidemiology. We also have a team now on social and ecological modeling. Then we even have a pure mathematics team. So anywhere you can fit in, if you are interested in joining. So BMA is a relatively young organization, right? It was registered as a non-profit around 2020, registered in South Africa. It operates internationally, connecting professionals, early career researchers, and students. And then our activities include webinars and events, just like the one you are participating in today, e.g., on topics like AI in mathematics, healthcare modeling. Then we have a membership database for networking and collaboration. We have advocacy for diversity, equity, and inclusion in mathematics. And then we have outreach to build excitement and interest in the field among Black communities. So, I mean, you can find us online. We are on YouTube. For instance, this is being recorded, and it will be, in case you missed any part of it or you want to refer to any part of it later, you are going to get an email if you registered. So you are going to get an email that will include our YouTube link where you can watch the past webinars and even this one, because I know it's going to be a very solid presentation from Dr. Idisi Oke as it talks about data fitting and parameter estimation. So we are on X, we are on Twitter, we are on YouTube, we are on LinkedIn. So BMA complements longer established groups like uh okay, I mean, we collaborate with other groups like ASB, that Association for Society of Biomathematics, all that. So we all work together to make sure Africa is on the map as it comes to mathematics. On this note, I take it back to Dr. Rabiu, to continue the program. Thank you so much.
Thank you so much for that presentation, Dr. Dansu. Really been a lot. So that is a very good introduction to what we do at BMA. So everyone is welcome to be part of the research team, and we are going to gain more about about collaboration and presentation. So we have published more than 10 papers, Dr. Dansu. We have published more than 10 papers.
I'm sorry, and we still have like 5 or 6, still, yeah, and we keep going. Interestingly, thank
Yeah,
you so
yeah,
much for that. Yeah.
yeah. Yeah. Thank you so much. So we are moving directly to the item number 3 on the list, which is the introduction and selection of the speaker. We are very lucky today to have one of the best speaker, or let me say one of the best researcher in BME. Let me say one of the most active researcher in BME, in person of Dr. Idisi Oke. So Dr. Idisi Oke is a researcher specializing in mathematical modeling and epidemiology with a strong focus on infectious disease dynamics, model calibration, and data-driven approaches to inform public health decision making. His work covers a range of infectious diseases, including COVID-19, mpox, tuberculosis, and other emerging and emerging threats. He has published in international journals and continues to build a growing scholarly impact in the field. Dr. Idisi Oke is a graduate of the Federal University of Technology in Akure, where he completed his master's and his PhD, and he is currently active in so many research work and is ready for collaboration with anyone who is interested. So that is a brief citation about our today's speaker. And from now on, we are going to give the microphone to him to start his presentation. May I welcome Dr. Idisi Oke. Please, you have the floor for your presentation. Thank you.
Doctor is Idisi, you are muted, sir.
Yeah, thank you very much, Dr. Rabi, for that brief introduction. I don't know if you can hear me clearly, Dr. Dansu.
Yes, it's fine now.
Uh, can you hear me clearly?
Yes, you can see you, Dr. Idisi.
Yeah, but can you hear me? Am I that audible?
Yes, you are audible. But if
Okay,
possible, you
thank you.
can increase it a bit. Yeah.
Let me see if I is better. Can you hear me clearly?
Yeah, it's better now.
Yeah, I was trying to minimize the noise from the environment, but if it is okay like this, it's okay by me. Thank you very much, Dr. Rabi, for the brief introduction. Thank you for at least being the moderator for the day. If I must add to what Dr. Dansu said and what you said, that we have published more than 10 papers. I just want the House to know that among the papers I've published, at least I have been able to involve in at least 4 to 5 published papers already from BMA. Of course, I want to applaud BMA for the rare opportunity and the privilege that has been accorded to me. That everyone who has been active and be willing to contribute is going to benefit from the group itself. Once again, I really welcome everyone to be able to be in this meeting this afternoon. I won't want to waste most of the time. I am Dr. Idisi. My name is Idisi Oke. I want to go straight into the discussion for the day so that we can all get the essence of what we came for this afternoon back here in Nigeria, my local time. So once again, I welcome everyone. Sit back, be open-minded, be willing to get the to interact, to communicate, to contribute, and also to adapt where there is need be. Thank you very much. I want to share my slide and so I can go straight into the presentation. Thank you once again, Dr. Rabiu. I applaud you.
You're welcome, Dr. Idisi.
Share my screen. Let's share my entire screen. Okay, so my update. Last talk, I download my webinar. Go to view, go to full screen mode. Oh, good. Can you all see my screen, please? Dr. Rabi, can you see my screen?
Yes, we can see your screen.
Yeah. Once again, I welcome everyone to today's webinar. The focus is on parameter estimation and data fitting for epidemiological model. Of course, let me confess my imagination when I first see this topic shared by the committee. I was like, this is a very broad topic because it's encompassing parameter estimation, data fitting, and not just data fitting for also epidemiological models. This actually, I look at it holistically from 3 different views because before you can estimate parameters, one should be able to fit, and before you can also fit, one will also have to fit into an epidemiology world. models. So there are three things that I will be running us through in the process of on the course of this topic this afternoon. And I wholly welcome us to be of open mind and let us get the insight from it. So I'll run us through uh, the the presentation outlined for this afternoon. First, we'll be looking at the data fitting pipeline. I coined out this word because it's three different things encompassing before we can achieve the objective, the goal of parameter estimation. Then we'll be looking at understanding the epidemiological data because data is a key thing in data fitting. We'll also be looking at the epidemiological model itself. Then we'll now look at the techniques at which these data or these parameters are being estimated. Then we also look at the tools at which this process is being obtained. Then we'll look at some implementation of some examples in some of the tools that we'll be using this afternoon. So this is the holistic table of content or the presentation outline that I will be running us through and discussing on this afternoon back here in my own local time. So I want to go straight to what do I call the data fitting pipelines. I do not know the pro knowledge we all have when it comes to data or data fitting or epidemiological models or parameter estimation, but I just want to take it from the simple phase that we all have to be on a same understanding of the essence of it. So I was able to put up this simple slide to have an in-depth understanding, for we to have an in-depth understanding of what the topic is all about. First, we'll look at the data. So the pipeline is going to take from the data down to the model, down to the parameter estimation, and the validation of those data. Because for you to be able to achieve a data fitting that is of good, a good premise or good resonance, it has to also be validated. So I tag this as a data fitting pipeline. If we understand this flow process, data fitting becomes something that every one of us will have a full understanding of. However, I want to be taking it one after the other, following this sequence, following this process. If you look at the process that I present here, it's a simple flow from data, and data itself has to be which kind of data. So in that case, I will be bringing us back to, we are talking about epidemiological data because we are fitting this data into an epidemiology models. And so from my own fan, I just started, what do we understand by epidemiological data? Here I refer to it that is information that is collected to understand the distribution, the pattern, and determinant of disease within a population. If we understand this, it will be easy for we to connect with it, that this data we are talking of are not just data outside the context of epidemiology. Of course, we might have data related to other aspects of life aside the epidemiological data. So for we to fit in this data, we are actually looking at epidemiological data that describes the distribution, the pattern, and the determinant of disease in a particular population. And this we are also going to look at because this data talks about the trend at which disease outbreak is. It helps us to also understand the dynamics at which disease spread, and also help us to estimate key parameters. Because if we understand what the data is going to provide for us and the in-depth of the result of the data we are going to collect or we are going to gather, it will help us to be channeled and to be focused on the area at which we want to exploit it on. So first of all, we must have to understand that this data will help us that this data that are being collected should be able to help to monitor disease outbreak and trend. Secondly, that this data will help us to understand the disease dynamics also. Thirdly, it will help us to estimate key parameters from our own models, from the unknown parameters that we're going to have in our model formulation. And also from this data, we'll be able to inform public health and intervention policies on decisions worth making. And in conclusion of this data is that we are saying that this data should be reliable. They should not just be data. They should be data that are collected from a reliable source, a data that we can have confidence on in making use of the data to draw inference. If we get the data aspect wrong, virtually everything we might be doing might be wrong. So this will now lead me to my next slide by saying that how do we get this data? These data we are talking of that are important, that help us to understand trends, that help us to understand the dynamics of the disease that are being collected by an external source, by a reliable source. So this data also will not be classified because we are talking about epidemiological models. So this data has to be classified. Now, from the classification of this data, we have four types of this data. We have the incidence data, and we have the prevalence data, we have the mortality data, and we have the hospital records. Because if we understand the data first, it will help us a long way to mitigate a lot of stress. So when we talk about incidence data from our data, we are talking about the number of new cases that occur over a period of time. Let's take an example. When there was an outbreak of COVID-19, each day that this the recognized body, the recognized institutions are reporting this data. Those are incidence data. They are data that are reported in tracking the spread of the disease. Now, we also look at the prevalence. The prevalence the prevalence data themselves, they have to do with the total number of existing cases at a given particular time. Now, the total number of a given cases, remember we have the incidence, how they are reported on regular basis. But when we look at the prevalence, it helps us to understand that the total number of the existing cases that have been burdened in the population. So we also have the mortality data. If we have been able to have access to these bodies, we'll see how this data has been classified. So we have the number of deaths, we have the number of new cases, the number of cumulative cases. So this, if we understand the classification of this data, they will help us to be able to know the actual trend we want to achieve. So we also have the hospital records, that is peradventure you want to take out a mini research in the community and the hospital might have some good records that might help to influence the particular thing you want to drive at. So these are some of the forms of classification of data that we have viewed. Take a note from the beginning. We are filling the sequence, understanding the data. Now, in understanding the data, we need to know the classification of the data and what these data are also going to do for us. A lot of people do not understand this. So it is good that today we're able to get this insight from the presentation by knowing the kind of classified data that we are looking for to meet our respective project that we'll be needing in our respective research. However, it is not just enough to understand, but we need to know that this data are sourced from reliable sources, data that we can cite, data that we can make reference to, data that we can say, oh, this is the source at which these data are being gathered. So we have some of these recognized body, we have the database, we have hospitals, we have WHO report, we have surveillance systems, we have national health database, we have the like of them, the CDC, the WHO, and the rest of them. So our data, it will be very nice if we get our data from reliable sources. So when it comes to data and data sourcing, we should ensure that these data are collected from renowned institution. Please, let me ask again, am I audible, Dr. Rabiu?
Yes.
Yes, we can hear you, Doc. We can hear you, Doc.
Thank you very much. Now, from the data aspect, I have to also talk about the epidemiological model itself, because before we can fit, like I said, it is a chain process. It's a process that will lead us. We must have the data and we must also have the model that we want to put in this data for we to be able to what to fit. Let me see if I can get a pointer. No, we don't get the pointer here. Okay. It's a full screen. BMA. Now, let us look at these epidemiological models. What is epidemiology? These are simple mathematical representations. Like we need to have an understanding the data and the models. So I just want to talk a brief introduction on epidemiological models. Now, epidemiological models are models that are used to describe the spread and control of infectious disease within the populations. A translation of real-world problem into mathematical equations, into systems of equations. These are what we mean by epidemiology, especially on the epidemiological, on the health system, on infectious disease, on epidemiology. Or we call them epidemiological models. These models are how we translate the real situation, a real life problem, into mathematical equations that might capture all the necessary details that will capture all the necessary details that we are trying to look or to answer the questions for. So epidemiological models are simple mathematical equations that are translated from what into what mathematics. So, and some of them, if you look at most common epidemiological models, they have the inclusion of the SIRO, they have the inclusion of the SEIRO and the family type. We have the stochastic models, and we have other forms of models that are used to study to study disease dynamics. Now, if I may come down a little, some will say, what is an SIRO? And SIRO are the first models that were used back then to be able to understand disease dynamic by our mentors, our fathers in mathematics, in the scientific world. We talk about how the first malaria, the outbreak was being predicted and be detected back then, in the like of uh, 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 okay, let me in the previous at the early phase of it. So SIRO models were used, and this SIRO models has been extended to a dimensions that you could not even imagine, because what does it entails? We're talking about a susceptible compartment, the infectious compartment, and the recovery compartment. This make an SIRO model. Peradventure, there is anyone in this place that doesn't know what an SIRO is. It simply means a classification of the population into different compartment. Oh, we have those who are susceptible, we have those that are infected, and we also have those who have recovered. Then it can still be modified further. We have the SEIRO, we have SEQIRO, we have a lot of them based on what is your interest and how you intend to classify the population. So the SEIRO now, they have to include the exposed compartment into the SIRO. Then if you want to add quarantine, if you want to add isolation, if you want to add vaccination, whatever you want to add based on the question that you want to address. So these are how epidemiological models are constructed in the compartmental form. We also have the stochastic models, which incorporate randomness and uncertainty in this disease spread. Now, these SIRO models are also extended to other types of models. We have the age structure, we have the machine, the behavioral pattern of it. So it depends on what you want to address. But the fundamental thing about it is that they are real life situations that are translated into what? The mathematical world, into mathematical equations. However, these models must have to address the basis at which what you are developing there. So let us take a simple example of an SEIRO model, because I have to talk about the data, also talk about the model itself before we can fit. Like I said from the beginning, there is a flow from the data to the model to the parameter estimation and to the validation. So when we say an SIRO model, it's simply a compartmental model that I'm talking about the SEI or SIRO model this afternoon because I needed a model to be able to explain better for anyone in this meeting today to be able to understand how epidemiological parameters estimations are being conducted. So first, you must have an in-depth understanding of the model which you want to fit the data into. So for example, I'm taking an example of an SEI arrow that is formulated already, where my lambda represent my rebirth or my immigration rate, and my beta is my transmission rate, and my sigma is the progression rate from exposed to what? To the infectious. Then I have my gamma as my recovery rate and my mu as my natural death. This is a simple SEIR model. It is translated, if you look at it, you should be able to understand that this model is comprising of susceptible population, exposed population, infected population, and population that recovered. Of course, it is an ideal and holistic model that can be able to take in data for we to predict some certain parameters. Now, why are we talking about parameters estimation and data fitting? Because if you look at this simple model, there might be some parameters here that we might not have values for. This is where the data fitting is coming in. The data itself, the model itself is even classified into two. We have the state variable, which on the equations on the state variable, they are that will be on my left hand side of the mathematical equation, and we have the parameters that makes up the state variable. So we have the state variables and the parameters. So when we talk about parameters, there are those things, those values we might not even have the value for, but we want to determine those things to be able to have a realistic output. So when we talk about parameters here, in this model, we're having 5 parameters. We have the lambda, we have the beta, we have the sigma, we have the gamma, and also have the mu. These are parameters that we need value for to be able to look at what this model can generate for us. Then when we talk about, now we understand the data collection, the type of data that we need, and we also seen a simple SIR model, its framework and how it is, and how it is being formulated. Now let us even know, why do we need to do parameter estimation? Of course, it is very necessary because we already know that there are authorities that are reporting data on uh, on infectious diseases. So these regular data they are reporting, we can from there get to know from there, when we use them to fit our model, we can from there determine the best we can from there determine the value of those parameters that best fit our model. So it is very crucial at this level for you to know that it is not sufficient alone to understand data or to develop a model, but also to be able to conduct a parameter estimation. Now, when we say parameter estimation, like I said earlier, we don't know the value of those parameters, but we need those parameters to be able to solve our models so that we can translate the solution into real life. So how do we do this? So this have to go the process of what? Data fitting. So this data that we collected, that we're able to get from reliable sources, will be passed into the epidemiological model for we to be able to fit the unknown parameters that we do not have the value for. We might have certain values of those parameters from reliable sources, but we might not have all. It is not in all cases. So that is now the need for we to be able to conduct a parameter fitting. Again, it is not sufficient enough to feed, but we should also be able to do what? To validate these parameters that we are going to use to see that they have a good fit in what we are doing. So let me give a brief example of what I have been saying. Now, this is an example of a presentation of how the parameter fitting is done and the estimation. If you look at the model presented this afternoon, we can see that the round red dot are the observed data reported from WHO. And we fit this data into a predefined model that we formulated already. And we are able to show that the data that we collect, which is our observed data, is able to fit perfectly well into the model that we formulated. This will give a high level of certainty. This will give a high level of accuracy when we want to speak on this model that we have formulated, that this model that is formulated fit exactly to what the authorized authorities are reporting in our respective pages. So this is one of the reasons why we need data fitting, because if we just assume those parameters, if we just say, oh, this is the value we should use, we might not be able to use it to draw inference or to inform policy making. But if we have a reliable data that's able to fit properly well into our model, we can now be able to validate that that model can be used to predict, or to be used to determine, or to be used to bring out insight from our analysis. So the data fitting and the parameter estimation are just a way for we to ascertain that the model that we are using is able to give insight into what public. This particular thing is just, this particular image you are seeing on the screen is an extract from one of the recent work we did in BMA. So it's actually one of the recent work we did in BMA that I was able to pick up this simple image of parameters fitting, and I brought it on the screen. So now we understand the simple example of an SIR model and the type of data and the classification of data that we'll be needing. Now we'll be looking at into what are the techniques that we'll be applying, that you need or that we need to apply to be able to fit the model. Now we know our data. Now we have understand the epidemiological model. Now, what are the techniques? What are the things that we'll be needing to fit in this? I took my time to ensure that I explain this process so that it will not look ambiguous by the time we go into parameter estimation. So we have some of these techniques that are commonly used for fitting of data. We have the least square method. We have the log scale fitting method. Now, each of these methods can fit depending on the nature of your model. They all fit. Commonly, people use least square method. In fact, the example I'm going to base it on the least square method. So there are different techniques that are used in parameter estimation. If you can have this, you can read them up and see the different way at which these different techniques are used in data fitting. We also have the gradient base. We also have the non-least square method. We also have the Bayesian approach, and we also have the minimum likelihood estimator. So there are a lot of the approach that we can adopt, we can apply for we to be able to do to fit our model. Hello. I just want to ascertain. Can anyone hear me? Dr.
We are
Rabiu?
hearing you, Dr. Idisi.
Okay, thank you,
Keep
Dr. Rabiu.
firing.
So I took time to try to establish that these are some of the techniques that we can apply to be able to have our data fitting and parameters estimation. So like I said, we have the least square method, which is commonly used by looking at the difference between the observed and the observed data and the output, so that it can be able to fit in the output and the observed. So these are some of the methods. We have the log scale, we have the gradient method, we have the non-least square method, we have the minimal likelihood, in the minimal likelihood, we have the Poisson, we have the log, we also have the Bayesian. I think I did not put the Bayesian because some of them are the Bayesian I will have included, but I didn't include the Bayesian approach where we have the PU, that is the statistical aspect of parameters or the estimation. So, however, we also have these particular ones. They are local minimum, right? Meaning that they might get to a certain level of that model that they might not really give you the right prediction. So we also have the global estimators, which talk about the particle swamp and the generic algorithm. So here are some of the approach at which we can fit or conduct data estimation. So if you have a chance, you can find time to read them up, and let us look at the tools that can be employed for this data fitting. Now we have looked at the data, we have looked at the model, we have looked at the techniques, but how do we now implement this? There are several tools that can be used. Some people make use of the arrow, some people make use of MATLAB, some people make use of Python, depend on your area of interest or depending on your area of expertise. Of course, like I was having a discussion with a French lady that said there's a particular course in French language that is called French for special purpose. Let me just digress a little. That French for special purpose means that what you want to do, they just develop the model for you to understand it. So it doesn't really have to be necessary that you must have 100% knowledge of arrow programming or 100% knowledge of MATLAB or 100% of Python. You can just go for the interest of the fitting alone, and that is really encouraging for you to be able to what? To conduct parameters estimation and fitting. So these are some of the tools that is used to be able to do what? To conduct parameter estimation. Then also we look at the validation of this model. It is not sufficient to fit the model. It is not sufficient to fit your observed data to your model, but you should also validate the model in terms of its goodness of what of fit. And some of the techniques that is used is the R square and the root mean square word error to dictate, to be able to understand that a high R square is good fit because it shows that it's giving you an R square with a high level of percentage, probably 90, 95, 98, shows that that model has what could fit. That is a goodness of fit test. So these are some of the measures that which, and a low RSME also helps you to understand that the model is what is well fit. So these are some of the ways at which you can validate the model at which you are working on. If I could take you back to the beginning again, I make it a flow process that from the data, we have the model, and from the model, we have parameter estimation, and after which that model is formulated and parameters are fitted, we also need to validate with our goodness of fit, which is our R square or our root mean square word errors. So that being said, we could now look at some of this. This is where my presentation ends regarding my theoretical word explanation of the process at which we can estimate data. Dr. Rabiu, Dr. Dansu?
Yes, Dr. Idisi.
Yeah, so from my theoretical end, I have been able to pass my message, but we'll have some sections on looking at how do we fit using any of those tools that we have said. Do I have much time again?
Yes, you can continue.
Okay, thank you, Dr. Rabiu. So at this point, we'll be looking at first, I want us to have a generic
Hello, sir.
data, generic data to be able to fit these models. So from there, we can understand how this process is done. So however, we're going to look at this model and I have to open probably my MATLAB. I'm going to use MATLAB like one of the tools. I'm going to open my MATLAB to conduct a parameter fitting. Based on time, I've already predefined it, but I will run us through how this process works. Escape so that I can show my MATLAB. It's not yet open. Oh. Okay. Uh, Sorry, I'm trying to split my screen so that we can see the model and so we can see both of them side by side. Doesn't want to show. Stop sharing.
Okay. Nice. Yes, yes.
Congratulatory words. We got to speak to the administration.
Yeah.
Okay. Yeah, two different screens.
What's that called?
Yeah, hello, sorry for that. I tried splitting my screen, but I'm not getting it. But I will just proceed with my MATLAB interface. So I think I can minimize and open it up. There can be two different so there's two different work. So get bigger. Two different screens. I'm showing. What is giving me issue? Okay, I just want through them. Okay. So hello, sorry, Dr. Rabi, can you hear me?
Yes, I can
I
hear
can
you.
hear you, Dr. Idisi.
Oh, okay. Sorry for that. I intended sharing my screen into two so that we can see the OD, the epidemiological model, and also see the MATLAB itself. So I'm going to use the MATLAB to run a generic code. Then after, I will not take a real life situation from my slide. Then we also fit in that. So when we look at data fitting, first, let me just give a run overview of this. This is my MATLAB, and if I run, it's going to generate the fitting for me, which I'm going to take time to explain. And at the end of the section, if there's a need for you to get the code, I will also share the code. So currently it's compiling, but let us look at the solution before I will share my screen. This is a generic code, and like I said from the beginning, here is the code, and here is my parameters that I estimated from that model. In that SEIR in the SIR model that I showed initially, I have this simple model that for me to test in generic data into it and see the outcome of what I'm going to feed. So from this simple uh, model, I have a generic data that I put in to test the fitting process. Now, the red itself shows my observed data, and the blue line indicate the result that the model generated out from what I have fed in as a result of parameter it estimate, a parameter that I feed in and the parameters that it estimate. From the parameters which is estimate, I'm having these three parameters from the model that is estimated. And I also conducted the validity by checking the root mean square error and the R square. There are different ways we can check for the validity, but I'm sticking on this particular two to be able to do the validation of the fitting. So my root mean square error here, it showed me 37. So what does that really implies? It implies that at least from the total numbers of my estimated point of about 450 cases, 37 is deviated from the original from the total cases that I am considering. It implies that the model is good, but the error that I'm getting is not that much. But again, when we look at the R square to check the goodness of the fit, we can see that I'm having about 0.93, of which about 93% of goodness of fit. So, however, but we still did not have 100% good fit, but that has to do with adjustment of the model. Of course, it's not going to be a one-off holistic solution for we to get the exact 100% fit we're looking for. But however, we cannot have an arrow square of 1. Of course, that is not biologically sensible, but we can have a range from 95% and the rest of them for which we have a good model fit. But this is just an example from the previous model that I explained from my presentation. But however, I'm unable to split the screen for we to see, but I can go into the model aspect of it, and I will start from there. Then I will take us through on on a step-by-step basis on how this model was conducted. So here I have an SEIR model, like as I initially did before by showing that model. Please, is my screen a bit visible for us to see?
Yes, yes.
Yes, we can see it here.
Okay, thank you very much. So I first of all want to use a generic, we also have generic data to fit into that SIR model that was formulated for we to test its fit. So from here, we have the susceptible population, which is S, and we have the exposed, we have the affected, and we also have the recovered as initially said. So we're having the gamma, we're having the beta, we are having the lambda, and we're also having the mu, which is our natural death. So from that model, we bring in the model itself first that we want to feed the data into. So from the base, I want to go to how this data, we're assuming here that this is our data, and our T data here simplifies the time at which we want to, the time at which this data are collected. Remember from the beginning, we talked about the kind of data that you want to work with. Like we said, we have the incidence data, we have the mortality data, we have the prevalence, we also have the which is the prevalence cumulative data. So it now depends on which of the model you have. So in this case, I'm fitting in cumulative data. We're fitting in cumulative here to be able to check, which is actually from the incidence of course. So here we're able to assume initially at this point we load in the data that we want to use to test the model. This data might be from any source, your reliable source, from the WHO, based on how it is being fitted. I do not have the luxury of time. I will have opened an Excel to show how these data are being reported in our respective website, but it are not always uniform. So it depends on how you are able to source for the data on them. Of course, recently we are working on a particular project on Marburg that we're still looking for how to get data, but it's not going to go through the natural way because not all data are actually available depending on the nature of the disease. So it now depends on your own knowledge, your outcome on which you can source for this data from a reliable platform. So let's take like a genetic data. We have this data being reported to us at this time intervals, and we have these data that have been reported over the period of time from this number to this number. You can see here that it's not an cumulative data, it's an incidence data, how they are happening, and that is how it is being reported. Because if it were to be cumulative, it will be in addition of the previous cases that it ought to be. So this is simply a reported cases or an incidence case. So we need to understand the kind of data at which we are working on. After that, we're able to define our parameters that will be loading into the model. From what we said the other time, we have the gamma, the fixed parameters, we have the gamma, we have the mu and the lambda. In this case, we are saying that don't fit this model. That's how we make it fixed, because we already know the value of these parameters. If you know the value, you don't need to fit for it. We only estimate or fit for estimate for unknown parameters. Parameters which you do not know their value, but you want the system, the model, the algorithm to able to provide close similarities to how the real data ought to be. So from this model, we assume here that we know our gamma to be, which is the rate at which they move from exposed to infected to be 1/7. That is in every 7 days that the incubation, the exposed period elapsed. So we are able to get the information about these particular data, but we are left with other data that we do not know their value. So we want to estimate those particular parameters. So once you get your data, you also look at your literature to see if there are existing values for those parameters that makes up your mathematical model. Then we also consider the initial conditions for the state variables, those on the left-hand side, like I talked of during the presentation of the SIR model. That's why I said we need to understand the model itself before we can even conduct parameter estimation. So you need to know that you're still going to have the state variables, initial values, and the existing or the known parameter so all these that you have known, fit them into the model. Then the ones that you want to estimate, you can also put them in and define a bound for them. Now, we do not know, but we just assigned a value for the unknown that we want to estimate. So we want to estimate the beta, we want to estimate the sigma from that particular model. Someone will ask me, what is K doing? I just want to use K as what? As a scaling factor for me to be able to have a reasonable to have the accurate fit that I want by putting a bound on what I am estimating. So the two major things that I want to estimate is my beta and my sigma. Already, I know the value for lambda, I already know the value for mu, I already know the value for gamma. So I think I can pick an annotation. Yes. So, easy for annotation. Yeah. I think I should have a better spotlight. I think I need. Sorry, I think I want to take okay. Annotate. Let me do it. I needed to pick what is it called, self. No problem. So now you feed in the parameters you want to estimate and define a bound for them. There is no particular way to define the bound, but as you write the model, you should be able to look for a range at which this bound should operate. So I define the lower bound and the upper bound and the initial guess of the parameters that I want to estimate. Then we call in the function that we want to use to estimate those parameters. So in this function, which is the least square co-fitting function, that is already an imputed function in MATLAB and probably other call from other softwares that can be used for fitting. So we have to fit we have to provide everything we need for this function to work. What we are saying here by the interpretation is that we are telling me that we have an SI arrow that is scaled to these parameters. So we put in the time, we put in the state variables, which is our I naught, we put in the parameters at which we already have the value for, and those which we want to also estimate. If you look at parameter naught, are our estimated what? Our estimated parameters that we want to fit into it for him to be able to give us the estimated parameters that we want him to do what? To put in to drive the what? The fitting for us. So you provide every necessary information, the model itself, the initial condition, the parameters that are known and the ones that are not known, the data at which you are fitting in, the lower bound. And so this is a prompt or an inbuilt function in MATLAB that helps to do what? To conduct parameters what? Estimation. So in it, we have to extract our values that are estimated out of that what? Of that system. So again, we also need our ODE solver. What is going to solve that ODE that the model itself? Remember, we're bringing a least square function to help us to feed, but we need to solve the ODE itself, the differential word equation. So this command, this is ODE45, will also help us to solve that simple word, that ODE numerically by providing all the necessary things we need for that ODE to work. The same way we feed them into the least square, we also feed them into what? ODE, into the model we formulated so that the ODE can solve. Then here what we did here is that I want to get the metrics to get the validation of the model. So we provided the RSNE and also said you compute what to compute for the root the R square. So this is the formula for the RMSE, the root mean square error, and what the R square for validity sake. Then here I said it should print out the validity, should print out the quality of the feed, and also to print out the parameters that I said it should estimate. Then here it should plot both the observed as against what? As against, can I run this? Yes, it stopped already. Continue. So that I can use that as an example. So this section will help us to plot the observed data, which is my arrow naught, which is what we fit in with initial time 1 to 30, and the data that are recorded that are generated randomly into it. I should plot it and indicate it with a round, a red ball, and also to plot the fitted plot from our from our model that we fitted. So here is the function that helps us to solve this function that we called in MATLAB to be able to help us to put in the estimated value into the incidence, which is what we are trying to look into. So this function here helps us to extract the fitted parameters we are fitting into and help us to pass it into our ODE 45 and also to pass it into our least square error. So here, like I started from the beginning, is a function that we need. First, we define the state variable, which is on the left hand side of our epidemiological model, which is the SEI arrow. We define it as the state variable, which is our Y1 to our Y4. Then we pass it into our model. So the OD45 will help us to solve this and pass into here by taking the parameters. So this is the simple model that help us to get this plot. So by adjusting of this model, we could be able to get a reasonable one. Like I said from my introduction from the beginning, while I was I'm having more than one screen. That is what is giving me issue now. If you look at from the beginning when I was talking about the pipeline, I said this has to do with adjustment. What did I indicate it?
Dr. Idisi.
Yeah.
We have about 10 minutes to round up the program.
Yeah. So the model itself, the fitting itself has to be adjusted based on the initial value that we are putting into. So at this point, I also want us to look at another example by taking a real life a real life situation from an Ebola, a real life situation. Yes. So initially I ended my meeting from thank you, which is this, but I kept a real life work from an Ebola virus that was generated. So this is a simple SID model: susceptible, infected, and dead, because Ebola is deadly in terms of its transmission. So this particular model was published, and I went and I picked it up to see how I can fit the data into it. So at this place, this model is what I'm going to use as a live a situation. I can provide the link and every other thing that is needed for this model. So this model is dividing the population into two, but also the death, meaning that the death of the disease of Ebola can also cause infection. But we're also trying to look at the model consider the behavioral pattern, which is exponential to the force of infection that is being defined. So this is the model that I want to implement the real data fitting on. So that will have to take me back to my MATLAB, and I'll pull it up. I think it's Ebola fit. So same approach is used across every one of them. Same, like I said from the beginning, this is the Ebola model that the OD system is fed in. First, you get the OD system into your MATLAB. That this is my compartment S, I, and D. Sorry. So I can close this. Yeah. So let us look into the real model. So this is the OD system I want us to consider: susceptible, affected, and disease related. So this is my model that is well defined. Then I will move up and get the parameters that I want to use. So these are data I got for Liberia for Ebola data from 2014 to 2015. And this is the data that we got. And if you look at it, it looks more like a cumulative data. Like I told you, you need to understand the kind of data you are working with from the onset. So I take the cumulative data of Liberia data from their WHO, and we fit in the data into it. You can also read in, depend on your knowledge of your MATLAB. Then we also provide the initial conditions, like I said initially, for the state variables, the S, the I, and the D. And this is our initial guess for our state variable. Also, we read in we tell him to read in our data, which is our X data and our Y data, which is the data that was read in. So it's going to pick the time at which it's being recorded and the values of our P2 for him to be able to do the fitting itself. But however, before then, we also need to determine our initial guess for the parameters that we already know their values and the ones we did not know their values as initially said initially. So we want to fit these particular numbers of parameters from that model. So we also created a bound for them. So after creating the bound, we also bring in our estimator, our least square fit embedded algorithm in our MATLAB. So we call it and we pass in all the parameters that we need for him to be able to function properly. Then also we're not telling him to print the estimated parameters. If you cannot estimate, then here I put a little condition that if you can't estimate, then give us the data itself. But however, it's going to bring out the estimated parameters for us. But every parameter that you estimate, please kindly provide it for us by this particular place. So these are the parameters we want to estimate. So we now pass it into our ODE 45 for him to solve, as I initially said. Then after that, we test the goodness of fit of that model. Then we ask him to print it out and plot the observed based on what they predicted. Then we test the value, and that brings us to the end. So I'm going to run this particular code for you to see what the outcome will be. So, of course, This is now the model. If you look at it, it is more real because it is not generic as the other, because there are a lot of noise that we might be able to avoid or to get. So if you look at the fitted data here, you see that our ROSE is provided. Let me take this up. So these are the data, the parameters that we fit from Ebola. We fitted the P, the rho, the mu, the eta, the beta, because we did not know the values for them. Then we check at our goodness of fit, and we have the root mean square error to be 3, which is very good. And we have our R squared to be 0.99, which shows that the model has a good what? A good goodness of fit. So at this point, I will bring my presentation to an end. Thank you. And if there are any questions, we are here to attend. Thank you very much, Dr. Rabiu, for this time.
Thank you so much, Dr.
Rabiu, I can't hear you. I cannot hear you. I don't know if others can hear you.
I also cannot hear you. It's not clear. It's breaking.
Dr. Rabiu, we cannot hear you, please.
Wonderful.
We can't hear you at all.
Dr. Rabiu, we cannot hear you, please.
Uh,
Dr. Rabiu, we still cannot hear you.
in fact, you are just refreshing worry about
Dr. Rabiu, we still cannot hear you. We still cannot hear you, Dr. Rabiu.
And
Shit. Dr. Dansu, can you hear me?
Yes, I hear you, Dr. Rabiu, sir. Hello.
We can't hear Dr. Rabiu.
Yeah, I think maybe his network is breaking.
thank you so much.
Dr. Rabiu. Hello. Oh. Hello, Dr. Rabiu. Yeah, it's breaking. It's breaking. We can't clear. It's not coherent.
Dr. Rabiu network is bad.
Okay. Hello, Dr. Rabiu, in case I don't know, Dr. Rabiu, it's breaking. It's breaking a lot. It's been breaking for like 2 minutes. Hello?
Hello.
Yeah, okay. It's like it's better now. Can you speak? Let's see.
Oh.
Okay. It's really breaking. It's still breaking. Okay. Maybe I can stand in until the network. Maybe you can disconnect and reconnect, and let's see if it gets better. While you do that, I can continue. So once you show up, I'll just hand it over to you again. Thank you very much, Dr. Idisi. That was very solid. Like the theory, the practical, and everything was so on point. Thank you very, very much for that, sir. Can you? I saw some people doing some emojis, some people saying thank you because that was so impactful. Yeah, somebody's asking, possible to get the recording and support material at the end of. Definitely, you'll get the video recording and the slide with Dr. Idisi's permission. Yeah. Yeah. So I see yeah, Dr. Rabi, please, can you disconnect and rejoin? Maybe to get better then. So, but while you do that, I'll just continue to take the questions. I saw someone's hand up. Okay, I saw a couple of hands up actually.
You can
Are you?
hear me now.
Okay, good. It's fine now. Exactly. So it's fine now. So I take it over. I hand over to you then.
Okay. Thank you so much, Dr. Daisu. I think there's a
All right.
breakdown in network communication. So thank you so much, Dr. Idisi, for that wonderful presentation. And I hope we have gained a lot, and those who know about it has also improved their knowledge. So we have a few minutes for questioning and answer. So if you have any question, please raise up your hand. From my screen here, I can see Abdulrahman Norat. Please put forward your question and it shall be answered. Thank you. Please kindly unmute your mic. Yeah, thank you.
Good afternoon, Doctor.
You're welcome.
We really appreciate your presentation. The first question I have is on that model validation, where we have R square. The formula I saw there was giving us I and yi, so I was expecting one of whether the numerator to be is not for this. Can you still employ the same data fitting for it, and will it serve the purpose well? Thank you.
Dr. Rabiu, did you get the question clearly? I couldn't hear her for like 10 seconds.
Abraham Nuras, please, can you recap your question?
Okay, thank you. The first is on model validation, where we have R squared. In the formula given in the slide, we have yi and then yi of t, yi minus yi cap. I was expecting that the numerator would be for x, while the denominator would be for y. We are subtracting yi minus the mean, and both of them were reading yi, both the numerator and the denominator. So I was expecting that one of them would be for x, while the other would be for y. Or is that what we are supposed to have? That's the first part of the question.
Okay.
Why the second part is that can we use this model validation and fitting for model equations that are for sociological problems, not disease per se?
Okay, thank you. That is noted. The next question, so that I can attend to everybody, Dr. Rabiu.
Okay, thank you. The next person here is Bashir Oyetunji. Please unmute yourself and come forward to present your question. Thank you.
Okay, thank you very much. And thank you for this beautiful presentation. So mine is things towards malaria. So just like other disease, it's usually difficult to have fitting for malaria data. Usually the data is secondary data from DHIS2 and is a form of incidence data that is reported monthly per health facility. So if you're familiar with the DHIS data. So we use a least square method, and we're having issue fitting the data. So I don't know if you can share some of the experience why fitting the data can be so difficult. Yes, I know you mentioned the data should be reliable. So, and our source is also reliable, which is the DHIS, which is where we report all the incidence data in the country. So, fitting the data for malaria has been challenging. I don't know, maybe your experience can also help us to do something better. Over.
Thank you.
Thank you, Bashir. Thank
The
you.
next person here is Fundile Cindy.
Hi, thank you, Doc, for the presentation. I'm sorry that I joined in a bit late. So my question is, I actually want to know, like, if I'm using parameters to actually estimate my data, how can I make sure that the parameters that I'm actually using are more like accurate and they represent the real data. How can I make sure that my parameters represent the real data? That's my question. Thank you.
Thank you.
Dr.
Thank you
Suleiman
so much.
Jamil, kindly unmute yourself and come forward with your question.
Assalamu alaikum. Thank you,
Walaikum
the
salam.
presenter, the moderators. My question is regarding the identifiability of the estimated parameters. So one important question is the uniqueness. Like we might have, the fitting might look good, but you might have many combinations. So based on the presenter's experience, do you know like of any methods that you use, or you can touch on that, just to make sure that how these parameters are uniquely identifiable?
Okay.
The next person here is
Thank you.
NSC. NSC.
Yes.
Thank you so much, Doc, for the presentation. I liked your flow diagram, very concise. I just wanted to ask, from your data, how were you able to decipher the values for the state variables? I just wanted to know, and also the time intervals that you use from the data. How were you able to do that? I'm thinking because, let's say, for example, if you want to model my data, for example, you would typically pull data from maybe DHIS2 and all of that. I just want to understand how you're able to estimate the values of the state variables and those time intervals. Then secondly, I was going to ask, I think I had a misunderstanding before that you can have like arbitrary values for your parameters, and then you do like a calibration to know the actual values of those parameters. But I think what you did here is you had like values maybe from literature for some parameters, and they now went ahead to do some form of estimation for the parameters that you don't have the values. I just wanted that clarity. But most important for me is how you're able to estimate the values for the state variables. Yes, thank you.
Thank you so much. Arinze, look.
Yeah, Dr. Rabiu, I think let me
Yes.
attend to some of these questions so that will not be too
Okay.
Dr.
cumbersome,
Rabi,
right?
I'm wondering, sorry, will you be able to remember all these questions? I think they should just ask questions and then respond.
Yeah,
In
that's why
that
Okay.
order.
I think
Yeah.
he has jotted them down, but at least this
yes,
is fine.
that's why I have
So
to
please, if your question has
pause.
been taken, please kindly raise put down your hand, please. If your question has been taken,
Ahead
kindly put down your hand.
so that I can
The floor
attend
is yours.
to.
Okay.
Thank you very much. It's
Yeah,
nice to
well,
hear Dr. K. It's nice to hear Dr. K voice in the meeting. Dr. K, welcome. So we'll start from with the first person who is asking about about the model validation and fitting. That is the person of Abdurrahman, who said, how can this model first be used, and the value of the arrow square, that what he saw on the slide, can it be adopted to other? Of course, the formula for the arrow square remains the same everywhere. It's a mathematical equation. So I would suggest that whether for epidemiological data or for social data, if you need to validate the output of your fitting, you can apply it anywhere. It is a well-known mathematical equation that can be used to test to do goodness of it anywhere, whether it is epidemiology, whether it is social economics or social ecology, as long as it is mathematically inclined and you are doing a fitting, you can use it anywhere. So peradventure, like I wanted opening up my my MATLAB for you to see that the formula that for R square, I don't know if you can hear me, Abdul Abdurrahman before Bashir spoke. Are you there? So the formula for the root mean square remains the same anywhere in the world. It is a known R square. So this is the formula for the X and the Y. And we take the difference when you take you divide and you take it from the one for we to get the percentage. So it is a known formula anywhere in the world. So it's as long as it is applicable for you to use it, it can be used anywhere. So I don't know if I am able to attend to that. So this is a formula for the R square. You compute for the X, the observed, the difference between the observed and the predicted. You also do the same thing for the X and Y. Then you take the difference, the average difference of it for you to get your R square. So it is the same formula anywhere. And I think that is what I applied here. If you run through with me when I was running through the model itself. So it can be applied in in uh in any place you want to use it, provided it is ideal. So this is the formula for the R square. So again, someone asked by Bashir. Bashir was asking that the fitting process, talking about the how do I get the parameters, yeah, fitting the models, fitting the model, yeah. Yes, of course, for you to be able to get the parameters first, you cannot have all the some situation there are some situation might occur that you don't even have all the parameters, like I explained from the beginning, why there are certain parameters in the literatures. There are people who has worked on whatever you're doing, and if you there is also a problem with overfitting. I'm not going towards that direction anyway. But if you already know the value of certain parameters, let's say, for instance, the death rate in a particular population, that you can know. You can know the value of the death rate from the population and the life the life expectancy from that particular country. You can know the death rate, or that is the general death rate you knew. You can also know the death rate due to disease from the data that you are seeing based on the reported cases. So there are certain parameters that you might know, and those you know you don't need to fit, so that you can have a reliable fitting for it. Then somebody also asked for the identification of parameters, that is trying to work on malaria and is unable to get it. That is using the least square fit method. Of course, like I said from the beginning, there are different approach at which there are different techniques for you to fit. Peradventure, the least square is a local minimal. It's not giving you what you want. You can switch to you can switch your techniques to a more advanced techniques for you to be able to get it. And remember, malaria is also seasonal somehow. And it depends on how your model is formulated. It depends on what you are looking at, and it also depends on what you want to achieve. So if the result is not giving you what you want, I would suggest that you switch your techniques, probably switch to a higher advanced level. Maybe you can switch to PSO, you can switch to generic algorithm. So those ones can help you to get the actual fitting or the desired result that you want. Then someone also asked me again I think Kenise was asking that how do you estimate the state variable from the state variable? Of course, the state variable on the right, on the left hand side, we cannot really have the entire that's what they call a deterministic model, right? Or a compartmental model. We might not really have, but we know the total population depending on what you want to do. So the state variable also, you can get some of it from the total population. Of course, if you have SI arrow, that means total population is S plus I plus arrow. Then you now have incidence cases that have been reported, which is the I. Oh, this is the group of the infected compartment, which you might get from your data. So all these things will help you to guide the initial condition on your state variable. So it is not a one process fit all, but you need to understand first the epidemiology of that disease. You need to understand the model you formulated and how you want to fit in this data into the model. So you can from the the project objective, or from where you are getting the data from, to be able to get a clue on how to estimate. We can also estimate state variable. I think I did one work with Dr. Rabiu back then, and we estimated some of when we're working on mpox, that we don't know the total number of population of the animal. So we need to we try to estimate to fit to get the actual fitting in that way. You can also estimate some part of the state variable, provided that you are not conducting an overfitting. But it is good to have an initial guess that will help you to guide you through. So the state variable can also, you can be guided on how to get it, knowing the total population, or which of the out of this population, which of them are infectious, how many people have recovered from this disease. So that can help you to get your initial condition while you are trying to conduct your work. I think so far those are the things that I jot on Dr. Rabiu. If there is anyone I'm missing behind, please they should just help me to align it. Can you hear me, Dr. Rabiu?
Yeah, thank you so much, Dr. Idisi. Yusa, can you unmute yourself and put forward the question?
Yes, thank you very much, Dr. Idisi, for that presentation. Please, I have two questions to ask.
Okay.
First, going through your codes, I've been trying to see on the data timing, where you indicated if the data is a daily data, monthly data, or yearly data. I don't know if I understood that part very clearly. And then secondly, you have fixed parameters, and then you have the one that we want to estimate. Can you show us where the estimated parameters, where we will see at the end of the work after running MATLAB, where we will see the estimated parameters? Please.
Okay. Okay, let me just attend to that, so that we'll be taking it one after the other. So I'm going to show you my code first. You're going to see my timing, whether it is weekly or whether it is monthly. So let's go back to the Ebola fit model. Now, here in my ODE, in my calling of my ODE, can you see my screen? I have indicated here that this is in what? In month.
Can you please expand your MATLAB screen?
This is the highest I can get. It's the full screen I'm sharing. I don't know if you can see it. I'm giving the full screen. Can you see my MATLAB screen?
Dr. Idisi, can you zoom in?
Yes.
If you can just zoom in, it will help visibility.
Okay. Zoom. Close this.
Now you can control plus. It will zoom by default.
Okay. Now here, I have indicated here that my data is in month. Remember, can you see my screen?
Yes, we can.
Yeah. So if you look at my initial, if you see my initial presentation, I try to run you through which of the data do you want to use. Do you want to use incidence? Do you want to use prevalent? Do you want to use monthly? But for this particular simulation, I indicated here that I want to use 12. I can also show you, I also wanted to show this code also before. And here, I think we indicated that it is in weeks. So this will help you to indicate whether it is weeks or whether it is in months. So here I have 52 weeks. Are you getting me? So this will help you to know whether your data is in month, in weeks, or in days. So that will also have to come to the knowledge of your MATLAB. So when privately request for the code, you need to study so that you can understand when to use the month or the week, depending on whatever you want. But that is indicated on the code. Then secondly, we're talking about the parameters we fix and the ones we did not fix, and how do you want to see the result of the estimated parameter. When you run the MATLAB, it will give you the parameters that you fitted. So this is the root mean square, and this is the parameters which were fitted from what? From the system. I don't know if I'm able to attend to your question. Please.
Idisi. Idisi, can you unmute yourself and okay. Your question, please.
My question is,
Arinze, I can hear you, please.
Mr. Idisi.
Yes.
We can't
Can
hear.
you
Okay, yeah. Yeah, we can hear you now. Mr. Idisi, we can't hear you.
Hello?
Hello?
Can
We
you hear
can't
me
hear
now?
you. Yeah,
Can you
yeah.
hear me? Okay.
Yeah, yeah.
Sorry. Please, my question is this, because sometimes when you code, then and run the code, sometimes it might not actually give you what you want. My question specifically is on initial guess of parameters. How do we choose those initial guess parameters? Should we make it the range very wide, or should we constrain it a little bit? What are we going to do? Because sometimes we don't get it actually. And again, after running your code, you look at it, it's very smooth and clean, but the output doesn't give you what you want. As a researcher, what should be your first point of adjustment? What do we supposed to do to get it right?
Okay, thank you,
Thank you.
Arinze. Yeah, of course, these are, like we said, I wanted going back to the slide that these are not, they are not predefined solution to when you are doing a fitting, but there are ways when you code, you should understand when you have an issue with a parameter and when you're having an issue with initial guess from your initial value. We have the state variables and we have the parameters. Now, again, each of them can influence the behavior of the fitting. Now, let's take for an example that my first data point here is starting from this point 0, right? Now, and when you code, your blue is starting from 50. For example, when you run the code, it's starting from 50 instead of to start from this particular first point. That will tell you that your initial incidence value is wrong. We are fitting the incidence as against the data. So it means that you have to go back. So like I said, it depends on the knowledge of your coding anyway, because these are serious issues, especially for those who are doing Bayesian. If you don't have a reasonable data, you don't have the actual what you are looking for. But it's over time, you get to understand how this work. So if you see that the data, if you are plotting and the plotting is not giving you, especially a good initial guess from where you need to start from, you should look at what you are plotting against. What am I plotting against? Am I plotting the incidence? Am I plotting the prevalence? Am I plotting the cumulative? Then go and check the compartment that makes up that thing. When you check, you should be able to adjust to get a good range. But however, it is good to have a range. Now, when you are putting a upper band or a lower band, if you take a look at some of the code, it's not that I have a particular way of getting it, but over the time, we try to create a bound that everything will work fine. Now, if you're looking at the bounds that are created in this place, you see, I do not want my lambda to be more than 3,000. So I can even fix it here. I can even make it fix here because I've already calculated, I've already computed that it should not be more than that based on my recruitment into the population. So you should be able to have just a clue, or probably you want to use mu, and you know that mu cannot be 1. How can that be 1? That is, everybody's dying. So you understand that it will help you to understand how to condition the upper band and the lower band, especially when you are doing fitting. You should look at your parameters. Sometimes you can manually vary your parameters. Try and play with it. Try and see what is going to give you. Then you should be able to see the output on the model itself. This particular model, if I paraventure, I take my band to be, if I give an instance, if I take my band to be 0.1 and 0.1, the model is going to change. The output is going to change. The output will change. There is a little change in the output. But if you check my arrow square, you see that I still have 0.9, and there's a little change in it. So sometimes you have to check. There are some parameters. That's why I have the sensitivity parameter sensitivities. I didn't go into that area because we're only doing at fitting. There is what we call parameter sensitivities, sensitivities of parameter. Which parameter is more sensitive? We have the normalized index to do that. We have the PROC to do that. Those are how to know which parameter are more sensitive to your model. And in that case, by the time you altered any of those parameters, you will see that they will make a lot of impact in you. So I believe that this question I'm being asked here is talking about the sensitivity of parameters. You should look at your parameters to see which one of them is more sensitive. If I go back to this simple fit and I try to mutilate the value of beta, here I said my beta is my gamma, gamma, let me say, put 1/20, 1/50 here. You're going to see that there's going to be a lot of difference in the output. Do you see it now? It's a lot of difference because you really do not get the literature behind what you are coding. So it depends. So there is no one way around it. So first, I would advise that all those that are having issue with not knowing how to control, they should try to check.
Dr. Idisi, we can't hear you. Hello?
Sensitivity index, actually parameter sensitivities. They should check which parameter mostly influence the model. If you add a little
Dr. Idisi? Dr. Idisi? Dr. Idisi, we can't hear you. Dr. Idisi, we can't hear you. Okay, yeah, we can hear you now.
Yeah, I don't know if the last person that asked me, Arenze, was able to get my response.
Yeah.
Thank you. Thank you. I got your response. I got it right. But the
So
sensitivity
but the
analysis,
last part of it, I said, let's always try to conduct parameter sensitivities to know
no,
which of those.
the sensitivity analysis is far from what I'm saying. I know I know the sensitivity analysis of a thing, and I understand that side. But it's just like in that coding aspect, first time it will run, it's not going to give you accurate. It's not going to give you accurately like what you want. So that's the place we talked about, the initial guess of parameter, the lower band and the upper band. So I wanted to know if it actually has a lot to control the estimation, whether we should make it closer or should make
the
it
lower
wider.
band and the upper band has a place, because if you are creating upper band for multiple parameters, you don't even know which of the band that is going to constrain your fitting. So it's
Yes.
always good. So it's always good to fit fewer parameters so that you can be able to is a bound. You do not even know it. You just to me, I don't know if you have a better insight, but I'm trying to tell you that always work within your band. Sometimes you can constrain it. Let this be greater than this by 100. Let's be greater than this by 10, by 5, and see how it behaves when you compile. There is no one way out of it.
So much. Thank you.
Sorry for the stress is always taking you.
No problem.
Thank you so much, everyone, for the question. I think one last question. Someone asked here, the data presented in the second model were the cumulative cases. Which part of the model did you match with the data?
Okay. Which part of the model did I match with the data?
Yes.
Yeah, like that question, let me go backward to respond to that. First, you that you are doing the fitting should know what your expectation is and what you are doing. So the part of the model that is matched here is the incidence data, the affected part of it, because the cases that are reported are the infected cases. So we are trying to match our model with the infected cases. That's why I said you must have a full understanding of the data, a full understanding of the model, a full understanding of the techniques that you want to use, which take me back to my initial slide. Because it is not just estimating, but you must have a holistic understanding of what you are doing. So if I'm asked that, oh, which part of the data do I actually feed? Of course, I know that I'm working with incidence data, and I will look for the incident aspect of it in my own model and fit to it. I don't know if I'm sharing my screen. Okay, let me see. Am I sharing the screen? No, I'm not sharing my screen. I'll share the entire screen, right? So that I can go back to that place. So like I said that takes me back to the process, because the fitting process itself, you have to understand the data you collected. Is it incident data I want to work with? Are they cumulative data? What kind of data am I working with? And what am I expecting? The model I'm also formulating, do they have any part of that in the model? Or what do I want to achieve with the data and the model? So these are the first questions that every modeler, whoever that wants to conduct parameters estimation, we have to ask. So basically from the model that I feed, from the model that I presented, I fitted I'm trying to take this down so I can be big. So here is where I fitted the model. So I'm telling him to plot the reported data as against my I compartment, which is my infected compartment, because I picked the infected compartment to fit the model, and I'm planning to use that same data to fit it against. I don't know if I'm able to answer her question. Thank you, Dr. Rabi.
Yeah, thank you so much for the wonderful presentation. I think one more last question before we call it a day from Mr. NSC.
Yes, thank you, sir. I don't know if it's possible for Doc to just flash the data used and just walk through it. I would much appreciate that.
Yeah, like I told you from the beginning, this is the data that is used. This is a reported data. Remember I said from the first case, we use a generic data. The one I presented, I said, let us try a random data on it. Then we now use a reported data on the next one we'll be doing. And this is a cumulative data for Ebola in Liberia. That data has been extracted from an Excel and the point has been placed into this place. You can also read it in. You can read in the data or you can put it, depend on the value or the volume of the data that you are working. So here, this for the Ebola feed, it is cumulative. For the simple generic one that I used initially, its incidence was reported data. Oh, the first day we have one reported case. Over time again, we have 3. Over time, we have 7 reported cases. It is not accumulated. On weekly, monthly, it is being reported that way from a reliable source. I don't know if that answered your question, Aranje.
Thank you so much, Dr. Idisi. From Anna Ibrahim, we have, is there any specific way to choose a suitable method for your model? Or do you usually
hear you,
start with the
Dr.
least square method? Can you hear me now?
Is there any specific word?
Is there any specific way to choose a suitable method for your model? Or do you usually start with the least square method and if it fails, move on to other methods?
There are different techniques that you should use. Depend on the one you know. Different. So there is no specific way of saying, I want to use a least square method. You can use the logarithm aspect of it. You can use an advanced method depending on the one you yourself, you know.
Thank you so much, Dr. Idisi, for that
Dr.
wonderful
Rabi, can you?
presentation, and we thank all our participants for being today with me. Hello, yes, I can hear you. Can you hear me also?
I can hear you, Dr. Rabi.
Yeah. Last
Dr.
question
Dance,
here from Musa. He
Dr.
said, can you
Dance,
hear me? Dr. Idisi, can you hear me?
yes, I can hear you.
One last question from Musa. He said, I'm having trouble fitting my non-linear model to weekly data. The model validation is poor.
Shit,
What's your
I can hear you.
advice? I'm worried.
I didn't hear what you said, Dr.
Am I
Rabi.
audible?
Yes, but it's breaking.
Am I audible?
Yes.
Hush. Can you hear me now?
Yes, I can hear you.
He said, I'm having trouble fitting my nonlinear models to weekly data. The model validation is poor. What's your advice? I'm worried that using cumulative data might make some of the models nuisance.
Don't know if
Can you
someone
hear
else.
me?
I don't know if somebody else said what Dr. Rabi said. Please, I didn't get the question, but I know that the person is asking for an assistant.
Yeah, the question is in the chat. It says, I'm having trouble fitting my nonlinear model to
Is in
weekly
the chat.
data. The model validation is poor. What's your advice? I'm worried that using cumulative data might mask some of the model's nuances.
Yeah, there are two things there, Dr. Dance, the person asking the question. Now, if your model output is poor, you have to check your bounds, you have to check your initial conditions, you have to check because, again, it depends on what are you fitting against your cumulative data, like the understanding of your model itself. The data might not be the issue because they're already cumulative, but the the science behind the way you formulated your model matters again. Because it depends on again how the model is being scaled. You are using a cumulative data and you are using probably just a single incident or prevalence approach to fit a cumulative data. You should also you should be able to balance the two. You should understand your data and understand what you are fitting against. I think that was the previous response I gave to that person. So the issue might not even be the data itself. It might be the the underlying understanding of the model and what you are plotting against. And if peradventure your model, as long as your goodness, your test is not good, it implies that some parameters are going beyond their bounds in the model fitting. Because first, the way to validate it, your RMSA must be low and your R square must be very high for you to have that's why we now have to come about the confidence interval. What is the interval at which we want to plot against? So you need to validate carefully, because if it's giving the wrong validation, the issue might not be from the data. And if it's from the data, try the way to scale the data so that certain value will not go out of bound. It still has to boil back on the understanding of the way you code.
Thank you so much, Dr. Idisi, for that wonderful response. From at this point, we are going to call it a day. Thank you so much, Dr. Idisi, for making it today with us, for your wonderful presentation, and for
Thank you,
taking
Dr.
your
Rabi.
time to go through all the questions. And also, we thank the leadership of BMA for giving us the opportunity to tap into this kind of knowledge. We also thank all our participants for making it today with us, and also for being patient with us throughout the presentation. We hope to welcome you in our subsequent presentation in the future. Thank you so much, and have a great day and a great weekend ahead.
Yeah,
Thank you.
Thank you, Dr. Rabi. Before we go, Dr. Dansu, I'll make the 3 necessary codes available for whoever is in need of it. The slide is also going to be shared with BMA to give to whoever that is in need of it.
Thank you so much.
In addition to that, Dr. Idisi, and for anyone who wishes to be a member of BMA, I've already dropped the link on the chat, so you can just click on it and register to be a member. Thank you so much.
Thank you for that, Dr. Rabiu.
For today. So we'll be expecting
I cannot see the link in the chat. Can you just reshare it again, please?
Okay. Can you see it now?
On the chat?
Can you see the link?
Yes, the rabiublackinmath.org.
Yeah. Just click on it and apply to be a member. So thank you so much, everyone, for this wonderful time we spent together. We hope to be together in a subsequent meeting. Thank you so much. Bye.
Thank you.
Oh, please, some of us have not seen the link.
Yeah. It's in the chat. Can you see the chat?
I can see the chat, but I didn't see the link.
It's there. It's there in the chat.
It's not showing. It's not showing. It's not showing. Maybe you are not sharing to everybody.
Yeah, yes, even me, I can't see it.
I can't see it.
Okay, let me check. Can you see it now?
Yes. Yes.
Yeah,
Yeah.
thank
Yeah,
you
I
so
can
much.
see it.
Yeah, thank you so much. Bye.
Yes, thank you, Doc.
Bye.
Bye. See you next quarter
Bye-bye.
for another great one. Bye.
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 Bye.